So when I start, especially I'm going to target for these areas, lymphatic drainage is really important for the facial swelling. Hello, this is Dr. 𝗘𝗩𝗘𝗏𝗧𝗛. Today I'm going to introduce new Switzerland-made extracorporeal shockwave lasers. Extracorporeal shockwave therapy intentionally creates microinjuries within the tissues to stimulate a strong healing and regeneration responses. When these microinjuries occur, the release of inflammatory mediators and growth factors increases, activating the processes and clear out the damaged tissues and rebuild new healthy structures. As the tissue undergoes controlled damage, neovascularization is promoted, improving oxygen and nutrient delivery within the enhancing waste removals. This helps restore chronically inflamed muscles and ligaments. Shockwave also stimulates fibroblasts, encouraging new tissue formations. Because shockwave can reach the fascia layers, which is difficult for lasers to penetrate, that helps tighten and reorganize lax facial structures from the inside out, breaking down old collagens and promoting the creation of new, healthy tissue. When the loosened fascia regains elasticity, support around the jawline, the cheeks, and the nasolabial fold improves, creating a more defined facial contours. After shockwave stimulations, collagen production continues for several weeks to months, gradually improving firmness and elasticity. Unlike heat-based lifting treatments such as 𝗘𝗘𝗘𝗏𝗪 and thermage, shockwave therapy does not work by thermal injuries, so there's no risk of burnings. It can break internal adhesions after procedures such as thread lifting, facial lift, fillers, and liposuction. So when I start, especially I'm going to target for these areas, lymphatic drainage is really important for the facial swelling, especially start from here down to your clavicle areas. If I do this treatment, lymphatic drainage gets reinforced. This energy will encourage the blood supply as well, so your swelling immediately goes away. Also, as I mentioned, the real target for this shockwave is ligaments and facial muscles. So when it comes to muscle, especially start from here to nasolabial fold, if I do target here, your old collagens are break down, it make new collagen in the ligaments and muscle layers. It will help for the lifting procedure, especially if you get like 𝗘𝗘𝗘𝗏𝗧𝗛𝗏, whatever you want, like a 𝗘𝗩 after this treatment, everything will be much better. Also, if you have thread lifting, so if you have uneven faceline, this can break down those kind of side effects. It can make more evener. And if you feel a little bit of pain, it means you have some inflammation there. I directly target that areas and will break down those kind of things. And we call neovascularizations will occur. New vessels will come out again. It will help for the absorption for the old fragmented products. It will make new ones. It means you will get new muscles, new ligaments for your faceline. You also can target around the eyes. So once you see smartphones, you see computers, and your eyes gets droopy a bit, if I target these areas, it's really comfortable. And after this procedure, you might feel a little bit of lightness around your eyes, like you are getting new eyes. Without even numbing cream, we can target muscles and the ligaments all over your face, and even for the body as well. So if you feel a bit of pain, I will target that area a little bit longer, because when you feel pain, it means there are some chronic inflammations. If I target there, I can break down those inflammations. We can make new tissues there. If I target shallow areas, we can improve lymphatic drainage. If I go very deep, we can target muscles and ligaments. It has different effect as I switch the depth of the penetration of this treatment. So when people want to get procedure like 𝗘𝗩𝗘𝗏𝗪, titanium, 𝗘𝗘𝗘𝗏𝗪, and thermage, people might think those procedures can eliminate every concerns for your face. It's not really true. When you get old, your face, ligaments, muscles, lymphatic drainage have some problems. So with these machines, especially before the procedures like lasers and after lasers, we can reconstruct your basal problems of all over the face. If you do this shockwave, starting from this décolleté line to your neckline to all of your face, these lasers will reinforce every radio frequencies, every ultrasonography will get more meaningful. There are two types of shockwave. Number one would be focused one that I just used now. Number two is a radial shockwave. This radial shockwave can destruct body fat. So if you want more defined, made contoured line for the bodies, especially around your like arms, hip areas, thigh areas, Even without pain, it's a bit loud, but no pain. You don't have to worry at all. The sound would be a bit crazy, but no pain at all. So today, I just explained about the extracorporeal shockwave for focused shockwave and radial shockwave. If you have any questions, just comment to our YouTube channel. Thank you so much.